distinguished members of the head table, Dr. Louis Cadena from PAHO, my friend, His Excellency High Commissioner Ray Davidson, Dr. Frank Anthony, Minister Indar, members of Parliament, Regional Chairman, REO, Regional Health Officer, Dr. Ford, members of Parliament, Parliamentary Secretary, but most importantly, residents and the people of Region 3. Good afternoon. It gives me great honor and privilege to be part of this program this afternoon. As you're aware, I just returned from a very successful engagement in Suriname, after which we had very successful discussions with the Minister of Foreign Affairs from Brazil, which, by the way, included more help for the healthcare system. And then we are here today. So what is a very simple function, but with profound effect on the lives of people. We indeed live in very trying times. We're going through a global pandemic that requires action at every level. But the greatest of action is required at the individual and community level. And that is compliance and adherence to the protocols. Everyone asks a very simple question: how fast can the economy be reopened? But if we all conduct ourselves in conformity with the protocols and guidelines, the economy can be reopened much, much, much faster. Whether we like it or not, life has changed globally. We will have to learn to live with this pandemic, and we will have to learn to unlearn old ways of doing things. Public health is a serious issue, and public health requires not only the healthcare professionals communicating to the population what is needed. It requires the population understanding the importance of what is being communicated. So I want to take this opportunity to ask you, and I must recognize today the Region 3 COVID response team that is led by private sector actors, professionals, and members of civil society, and the Regional Administration Office. They have been doing an amazing job in supporting the COVID response, and I really want to thank them for the job they have been doing. I want to ask a few persons to stand so that you will know them. We are going to hold these individuals accountable in this region. They are young shoulders on which we have placed tremendous responsibility. But governance is moving in a direction where you will have to be accountable, where professionals must be accountable. As far as the financial architecture of our country allow us, we will support the healthcare system and we will support the professionals. Let me at this time take the opportunity of recognizing Dr. Vishwa Mahadio and Permanent Secretary Watkins. I will ask our Permanent Secretary first to stand so you can see him. These individuals must be known to society. Dr. Tandika, who will manage this facility and lead here, where is she? And our Regional Health Officer, Dr. Ford. Youth comes with energy, but we expect them to work together with those with experience in finding sustainable solutions. They are led also by a youthful minister. A youthful member of parliament and minister in Indar, the chairman, the REO. You must know them. And you must let us know when you believe that they are not delivering as you would like. I mentioned a few moments ago our commitment to infrastructure development for the healthcare and professional development. Some months ago, almost as soon as we assumed office, there was a strike among nurses. In addressing that strike, I said, we all have democratic rights, but we also have a duty and an oath depending on what career we take. And I said to the nurses and doctors that we understand their complaint, but we must have patience. We have to address issues based on the situation of the country. And I promise that the government will address the issue before the end of the year. And we also back that promise up by setting aside $150 million in the budget to support these professionals in the pandemic. And then Dr. Anthony and the health team said, how is it we will come up with a formula on who are frontline and who are second frontline and third frontline? And we sat patiently looking around to see what we can do. We have been able to cut programs and to find additional resources beyond the $150 million. And this afternoon, I want to say that we will consider every healthcare professional as frontline. And every healthcare professional will benefit from a 2 weeks equivalent, 2 weeks bonus pay before the end of the year as part of the response to the pandemic. I want the population to understand that we are doing things in a different way. I ask you to trust the government. I ask you to trust the policies. We only have what is best in the population's interests. As a people, it requires patience, understanding. There is a lot that has to be done. There is a lot that will be done. Salaries will no doubt increase. Allowances will increase. And other non-salary benefit will improve. Because whilst you have this direct bonus that will come to you, you're also included in the household COVID grant. You're also included in the children uniform program. You're also included in all the social benefits that the government is giving to society. And it will grow. Our economy will only get better and better, and conditions will get better and better. stay the course. Stay the course. Focus on advancing your careers and improving yourself. And to help you to do this, we are starting the 20,000 scholarship program next year, early next year. And we are setting aside special investment for courses in the field of healthcare, public health, nursing, nursing assistant, pharmacists. Because health and education are the key foundation on which the society will advance. And democracy is the bedrock on which it will grow. Today, we are here at this facility. When I was growing up, it was called Lenora Cottage Hospital. I had my first stitches at this cottage hospital. Today, we're investing more. But it's not only this hospital that we're investing in. Whether it's Saudi, Bartica, Linden, Mabaruma, Lethem, all the hospitals will see upgrade and improvement within the next few years. All the facilities will see tremendous transformation. And what is this transformation aimed at? It is aimed at decentralizing healthcare service. Decentralizing to the extent that we empower the local and regional authority to do more in the management of the facilities also. It is about building capacity. It is about reaching the unreached. Many times people have to make a decision as to whether they take $1,000 to pay the transportation costs to go to Georgetown Hospital, or they take the $1,000 and buy food for their children. When we invest in these facilities, we are bringing health care to the people. We are reaching the unreached. It helps us to reduce the cost of access to health care. And it makes health care truly what PAHO and WHO want it to be, a universal right. So, these are the tangible and intangible benefits of the investment that we are making. It allows for more efficient and reliable access to healthcare services, improving efficiency. But more importantly than this, I ask the professionals to make these facilities people-friendly. The most important responder when you get to a hospital is someone we don't even think about in the healthcare equation, the security. That is where customer service begins. Even the helpers and the cleaners, most time they are the first and direct point of contact, which means they too must undergo training if we are to create people-friendly environment. There is no sense for us to build these facilities and have the facilities and we don't have the human touch. And sometimes these are uncomfortable topics for us to discuss. But I'm very frank, Dr. Frank. And we have to be open about these things if we have to make the changes that are necessary. It requires sometimes a shift in our thinking and also a cultural shift. as to how we take care of public assets, how we take care of facilities. And on the other side of the equation, the residents also have duties. We cannot be abusive to healthcare professionals. We cannot treat them as if we own them. We have to both treat each other with respect. These are the type of changes that will add value to the infrastructure investment that we make here today. All of this can go to zero if we don't have the right mindset and human resource capacity to take care of it and deliver the service. We invested in over 1,000 doctors. Many of them are not in the system as yet. I've asked Dr. Frank Anthony to look at this, whatever hurdles there are. We need the doctors to be in the system at different hospitals and health centers, not in their homes. We have to get our human resource capacity out there to work and deliver to the people. My brothers and sisters, this is one of many investments we are making in this region. But I'm going to stick only to healthcare. Otherwise, we may go a long time. In the next budget, you will see that we are announcing expenditure of more than $1 billion for the upgrade of the West Demerara Regional Hospital. You give us the mandate by trusting us to lead this country. And we have a duty to honor that trust. We have a duty to respect that trust. And importantly, those of us, those who may not have supported that mandate on election day, we have a duty to win your trust so that together, in a unified way, we are definitely going to build together a stronger Guyana. I end like I end all other engagement. Those who try to divide us using ethnicity, religion, or any of those matters, do so for selfish reasons. It is only when you have a selfish interest or desire that you will want to divide people and hold them based on a selfish agenda. Healthcare is the single most important public good that emphasizes that all men and women are equal. If you don't believe me, remember this pandemic. It showed us, every single one of us, whether you're high or low, whether you're short or tall, whether you're orange or pink, we are all the same, and we can all suffer the same consequences. Let this pandemic be the instrument that reminds us that we are all one and bring us together as one people. May God bless you. May God bless your families and all our healthcare professionals, our PAHO rep, our High Commissioner. And I close by saying to you, as the media is here, I received news of my death in Suriname. And I received many calls from my village. But whilst that announcement was read, I was looking at a military parade. But that is just minds that have nothing to do. I want to encourage them to use that energy positively and help in the building of a country we all love and we all want the better for it. Thank you very much. God bless you.